Hello everyone and welcome back to my channel. In this video, we're diving deep into the topic of tetanus and the important role of vaccines in preventing tetanus infections. Tetanus is a serious bacterial infection that affects the nervous system and can lead to severe muscle stiffness and spasms. It's caused by the Bacterium Clostridium Tetani, which can enter the body through wounds or cuts. I hope this video will be helpful for anyone looking to learn more about tetanus, how the vaccine works, the technique and process of administering the vaccine, and potential side effects. First, let's talk about how the tetanus vaccine works. The vaccine contains a purified toxin produced by the bacteria that stimulates the immune system to produce antibodies. This way, if your body is exposed to the actual bacteria in the future, it will be prepared to fight it off. Next, I'll explain the various methods used to inject the vaccine. Generally, the tetanus vaccine is administered intramuscularly, usually in the upper arm. The process is relatively quick, and healthcare professionals are trained to ensure it's done safely and effectively. Now, let's discuss some potential side effects of the tetanus vaccine. While most people may experience mild reactions such as soreness at the injection site, fever, or fatigue, serious side effects are rare. It's crucial to talk to your healthcare provider if you have any concerns or a history of severe allergies. For those wondering when to get vaccinated, the CDC recommends a primary series of vaccinations in childhood and booster shots every 10 years thereafter. If you sustain a wound, especially a deep or dirty one, you may need a booster if it's been more than 5 years since your last one. Tetanus is a serious bacterial infection caused by the Bacterium Clostridium Tetani. The bacteria produce a toxin that affects the nervous system, leading to symptoms such as muscle stiffness and spasms, particularly in the jaw and neck muscles. Tetanus can be life-threatening if left untreated. The tetanus vaccine, also known as the tetanus toxoid vaccine, is used to prevent tetanus infection. It contains an inactive form of the toxin produced by the tetanus bacteria, which stimulates the immune system to produce antibodies that provide protection against tetanus infection. The vaccine is typically administered as part of the routine vaccination schedule, and booster shots are recommended every 10 years to maintain immunity. The primary use of the tetanus vaccine is to prevent tetanus infection and its associated complications. In addition to providing individual protection, widespread vaccination efforts have also led to a significant decrease in the number of tetanus cases worldwide. Overall, the tetanus vaccine is a critical tool in public health efforts to prevent the spread of infectious diseases and protect individuals from potentially serious illnesses like tetanus. The tetanus vaccine is typically administered as an intramuscular injection, meaning it is injected directly into a muscle, usually the upper arm. The vaccine contains a small, inactive amount of the tetanus toxin, which stimulates the immune system to produce antibodies against the tetanus bacteria. Once the vaccine is injected, the body's immune system recognizes the tetanus toxin as a foreign invader and starts producing antibodies to attack it. These antibodies remain in the body and provide protection against tetanus infection in the future. It is important to receive the tetanus vaccine as recommended by healthcare professionals to ensure continued protection against tetanus, as the immunity provided by the vaccine can wane over time. Do I need to get a tetanus shot every few years? Yes, it is recommended to receive a tetanus booster shot every 10 years to maintain immunity against tetanus infection. In some cases, such as a significant wound or injury, a healthcare provider may recommend getting a tetanus shot earlier than the 10-year mark. It's important to stay up to date on tetanus vaccinations to ensure continued protection against this potentially serious bacterial infection. If you have any questions or concerns about your tetanus vaccination status, it is best to consult with your healthcare provider. Can I get a tetanus shot sooner if I have a cut or injury? Yes, if you have a cut or injury that is considered a high risk for tetanus infection. It is recommended to get a tetanus shot sooner than the usual 10-year interval. The tetanus vaccine can also be administered as a booster within 5 years of a previous dose if needed. High-risk wounds that may require a tetanus shot include wounds contaminated with dirt, feces, or saliva, deep puncture wounds, burns, wounds with dead tissue, wounds caused by crushing or high-velocity injuries. If you are unsure about whether you need a tetanus shot after an injury, it is best to consult with a healthcare provider for guidance. They can assess the severity of the wound and recommend the appropriate course of action. I stepped on a rusty nail. Do I need a tetanus shot right away? If you have stepped on a rusty nail or any other sharp object that may have caused a puncture wound and you are unsure when your last tetanus shot was, it is recommended to seek medical advice promptly. A tetanus shot may be necessary if it has been more than 5 years since your last booster shot, especially if the injury is considered high risk for tetanus infection. Rusty nails are often associated with tetanus because the bacteria that cause tetanus are commonly found in soil, dust, and manure, which can be present on rusty objects. However, tetanus can also be contracted through other types of wounds that provide an entry point for the bacteria. To prevent tetanus infection, your healthcare provider may recommend a tetanus booster shot, as well as cleaning and treating the wound appropriately. It is essential to seek medical attention promptly following a puncture wound to prevent any potential complications. Do I really need a tetanus shot for a small wound like this? In general, if you have a small wound like a minor cut or scrape and it has been less than 5 years since your last tetanus shot, a booster dose may not be necessary. Tetanus is more likely to occur in high-risk wounds such as those that are deep, contaminated, or caused by objects that have been in contact with soil or manure. However, if you are unsure about your tetanus vaccination status or if the wound is dirty, deep, or has potential for infection, it is still recommended to consult with a healthcare provider. They can assess the wound and determine if a tetanus booster shot is necessary based on your individual situation. It is always better to err on the side of caution when it comes to tetanus, as it can be a serious and potentially life-threatening bacterial infection. If you have any concerns about the wound or your vaccination history, seeking medical advice is advised. Do you think I should still see a doctor even if the wound doesn't look too bad? It is generally recommended to consult with a healthcare provider for any wound that raises concerns, regardless of its appearance. Even seemingly minor wounds can sometimes lead to complications, such as infection or delayed healing. Here are a few reasons why it may be helpful to see a doctor for even a seemingly minor wound. 1. Assessment of infection risk. A healthcare provider can evaluate the wound and determine if there is a risk of infection, which may not be apparent to the naked eye. 2. Tetanus status. If you are unsure when your last tetanus shot was or if a booster is recommended, a doctor can provide guidance on whether a tetanus shot is needed. 3. Proper wound care. A healthcare provider can provide instructions on how to clean and dress the wound properly to promote healing and prevent infection. 4. Peace of mind. Seeing a doctor can provide reassurance and ensure that any necessary steps are taken to prevent potential complications. If you have any doubts or concerns about the wound, it is best to seek medical advice to ensure proper care and to address any potential issues early on. Do you know if there are any side effects of the tetanus vaccine that I should be aware of? The tetanus vaccine, like any vaccine, may cause side effects in some individuals. Common side effects of the tetanus vaccine are typically mild and temporary, such as 1. Pain, redness, or swelling at the injection site. 2. Mild fever. 3. Headache. 4. Fatigue. 5. Muscle aches. These side effects usually resolve on their own within a few days and do not typically require medical attention. However, if you experience any severe or persistent side effects, it is important to seek medical advice. Rare but more serious side effects of the tetanus vaccine can include allergic reactions or neurological symptoms. Signs of a severe allergic reaction may include difficulty breathing, swelling of the face or throat, or a rapid heartbeat. If you experience any of these symptoms after receiving the vaccine, seek immediate medical assistance. It is important to discuss any concerns about potential side effects with your healthcare provider before receiving the tetanus vaccine. They can provide guidance on risks and benefits and address any questions you may have. Should I be worried if I experience any side effects after getting the tetanus shot? In most cases, experiencing mild side effects after receiving the tetanus shot is normal and not a cause for concern. Common side effects, such as pain at the injection site, mild fever, headache, or fatigue, usually resolve on their own within a few days and do not typically require medical attention. However, if you experience severe or persistent side effects after getting the tetanus shot, it is important to seek medical advice promptly. Serious side effects from the tetanus vaccine are rare but can include severe allergic reactions or neurological symptoms. Signs of a severe allergic reaction may include difficulty breathing, swelling of the face or throat, or a rapid heartbeat. If you experience any of these symptoms, seek immediate medical assistance. It is important to monitor your symptoms after receiving any vaccine and contact your healthcare provider if you have any concerns or if you experience unusual or severe reactions. Your healthcare provider can provide guidance on next steps and address any potential issues. I hope this video provides you with valuable information about tetanus and the importance of vaccination. If you have any questions or want to learn more, feel free to leave a comment. Don't forget to like and subscribe for more health-related content. Thank you for watching.